How to stay healthy in the wiregrass. Amazing new information on wellness from professionals. Your Wellness Network.
Colon cancer is the second leading cause of cancer death in the U.S. and fortunately there's opportunity to screen for this malignancy, and we actually look for polyps, which are what leads to cancer. It's the initial growths in the colon that turn into cancer. There's several different options for cancer screening. The best one is the one that the patient has done. The gold standard currently is colonoscopy. The risk factors for colonoscopy include dietary issues, including high-fat diet, diets high in red meats. There's lifestyle issues that extend to low exercise, lack of exercise in the diet, smoking, alcohol are big risk factors. And then there are familial risk factors, genetics, your parents, what genes you inherited. There's several different types of inherited forms of colon cancer. But the majority of colon cancers are sporadic, meaning they're not congenital, they're not inherited diseases. To reduce your risk of colon cancer, it's important to get screened. The current guidelines recommend screening at age 50 or 10 years before the age of diagnosis of a first-degree relative who is diagnosed with colon cancer. Screening is the most important thing. Lifestyle modifications, reducing your fat in your diet, reducing your intake of red meats, increasing your exercise, not smoking, and limiting your alcohol is important. Colon cancer is usually an asymptomatic disease. That's why we do screening for those in people who have no symptoms. And if you do develop symptoms, you can develop abdominal pain, bleeding, abdominal bloating, distension, obstruction type symptoms from a tumor. All of those are potential symptoms. A good age to begin screening is age 50 unless you have higher risk factors. And some of those risk factors include inflammatory bowel disease, familial history of colon cancer like Lynch syndrome, adenomatous polyposis syndrome, and those things warrant earlier screenings. If you do have a first-degree relative with colon cancer or high-grade polyps, we recommend screening at 10 years before the age of their diagnosis or age 40, whichever comes first.
Your Wellness Network. Presented by Digestive Health Specialists.